Hi, I'm Kate Brady. I'm the Director of Nursing at the Monarch School of New England, and we have some children with seizure disorders. So I'm just going to go through the training of administering medications, whether it's midazolam or Diastat, to a child with seizures. You have a new student that arrives to your school, and you need to make sure that they have if they have any diagnoses. This child had a diagnosis of seizures. I make sure there is a seizure action plan. I make sure that there are emergency meds, if any, and make sure that those emergency meds match the orders that are given. I then go through, if it is Diastat, I go through, check the expiration date, and check to make sure that the Diastat looks okay. That means checking to make sure the dosage is correct, making sure that the AccuDial is dialed and says ready, so there will be a green strip that says ready on it, and making sure the applicator tip is not cracked and it is attached. Now we have Johnny here, who you're going to go on a field trip with, so I'm going to go through training how to give him Diastat. One of the things you look at is your order and see how long you have to, when is the time frame of giving the Diastat. So some of them are 3 minutes, some of them 5 minutes. So he's been seizing for approximately 3 minutes. So we're going to give Diastat now. I take the Diastat, you look at the expiration date on the Diastat, you look to make sure the ready's there, the pin is attached. You have Johnny, who went on the ground, you roll him to the side and you start to undress him. This is given rectally at all times. And you're going to take your Diastat, which you've already checked, you're going to dip it into the lubrication gel, it's a little packet that they give you, and you're going to insert it into his rectum. When you're finished administering it, you then hold his butt cheeks together, and you count to 3. 1, 2, 3, and then you can redress. And you're going to continue to monitor his breathing and his seizures and continue to time the seizure. Occasionally, you'll have a seizure action plan that includes doctor's orders that state that you give a second dose if the seizure continues for such an amount of time. Just be aware of that. There are also cases, and it's not every case, that you do have to call 911. It is student specific and treatment action, the seizure action plan specific. Another option for emergency medication is midazolam, and it comes in different forms, but we're going to be training on the intranasal midazolam. It comes with a syringe with a needle. You take off the needle cap, you pull the plunger back to 2 mLs, you puncture the vial with the needle, you put the air in as you normally would, and you pull back. You then take off the needle and you put on the MAD device, and it just screws right on. And then you administer half of the dose in one nostril, half into the other. And you do a brisk push, and you do not need to squeeze or pinch anything. One nostril, then the other nostril. If you don't have the instructions for either the midazolam or the Diastat, you can look it up on New Hampshire Family Voice's website, and you can just print them from there. One tip when you're dealing with a student with seizure disorders is to remain calm. The people around you can feed off your anxiety, so if you remain calm, the situation goes a little bit better. And these children have seizures, and they are used to this. So if you remain calm, everybody else usually remains calm.